Hello everybody, my name's Judith Abbott and I'm the CEO of Carers Victoria. It's my absolute delight to invite you to this webinar tonight that's really about equipping carers like you for how to engage with MPs in a state election year. We have a whole lot of people joining us from across the state. I believe we even have a counterpart from Carers New Zealand joining us today, so welcome one and welcome all. I'd like to start by acknowledging the traditional owners of the various lands on which we meet. For myself, I'm here at the Carers Victoria office and we're on the lands of the Wurundjeri Woiwurrung people of the Kulin Nations. And I'd like to pay my respects to elders past and present, extend those respects to every First Nations person on the call today, and acknowledge the continuing connection of our First Peoples to these lands and waters, and that sovereignty was never ceded. So for today's session, we're really lucky to be joined by Zoe Daniel. Some of you may know Zoe from a 27-year career as a journo. Some of you might know her from her more recent career as a federal politician. But the thing that joins both those parts is that she's been on both sides of the conversation about what needs to change for people like us and how we might get there. And so in some ways she's a bit of a unicorn because she brings a really unique set of expertise. And the other thing I want you to be aware of is the fact that someone like Zoe is spending time with us tonight really reflects just how important carers are, and that she, along with so many others, want to work alongside us to make sure that carers are seen, carers are heard, and that when you need a bit of a hand, you can get what you need. So without any further ado, I'd like to pass across to Zoe. Zoe, welcome.
Thanks, Judith, and good evening, everyone. It's lovely to see you all, and thank you so much for joining the call. It really is my privilege to be here to help equip you with some tools for advocacy with your local MP. So your state MP in the lead up to the state election particularly, that's very relevant right now. But the things that we're going to talk about tonight and the tools that I hope to equip you with could equally be utilised for conversations with your federal MP or indeed conversations with your local councillors at local level within your communities. As Judith said, I do think that I have some unique perspective, having spent 27 years in journalism and for much of that time covering politics in Victoria, in Australia, and across the world in places like Africa, in Southeast Asia, and covering the first Trump administration in the United States. But I've been able to apply those experiences as well to my time as a federal community independent. As the member for Goldstein, elected in 2022, I spent 3 years in the federal parliament as part of the community independence movement. The synergies between those things are what I want to talk to you about tonight, and they're things that I think that you can apply in elevating the situations that you find yourselves in as carers. What I'd really like to try and help you do is articulate the needs of carers and your families and your communities to help you advocate, to change policy and to elevate those issues into mainstream media, for example, but really to facilitate conversations with MPs. I know that it can feel a bit intimidating, potentially, to rock up to your MP's office to try to explain the situation for you and what you think needs to change. But one of the things that I learned as a Member of Parliament was how helpful it is to actually have members of the community who have lived experience come and have a conversation about what's needed. I think it's important to note that you can't make assumptions about what MPs know. They actually need to be told. And the best way of doing that is to enable conversations between parliamentarians and you to really articulate the issues that are happening in communities and what can be done to support carers. And in a minute, Judith's going to go through the Carers Victoria policy platform, which will also give you some things to lean on in those conversations. But what I really want to say to you is that change is best delivered from the ground up, from the grassroots, from within community, rather than top down. But in order to do that, we have to be participants in the democratic process and actually enable that process by having these important conversations. Now, I know that for a lot of you, you have limited capacity to do that, but one of the wonderful things about a call like this and an organisation like Carers Victoria is that it enables the facilitation of bringing groups of people together to exert pressure, but also to simply shine a light on issues for real people, to help governments to understand how to deliver the best policy so that everyone has the most fruitful life that they can possibly have. I really encourage you to listen tonight and take from the conversation the things that work for you. Not everything's going to work for all people. Not everyone's going to feel comfortable walking into their MP's office and asking for a meeting, for example. Maybe you'd feel more comfortable sending a letter or making a phone call. Maybe you'd feel more comfortable asking for a meeting within a group to try to have that conversation with your MP. But whichever way you do it or feel able to do it, you should know that those conversations are valued, they're really important, and in order to enable carers' voices to be heard, I really do encourage you to have them. We've got a few months before a state election, and the major parties and minor parties in Victoria are going to be getting a lot of information coming at them, and it's really important that your voices are part of that in whichever way you think that you can participate in that process. The community independence movement was born from what we call kitchen table conversations, and they were actually developed by the Victorian Women's Trust way before I was elected. The concept was to get people around tables to have conversations about policy and politics from different perspectives, to take the combativeness out of those conversations and to enable constructive and productive change. And I think that sitting here having this conversation with you tonight is a similar kind of process. We can all take from it what works for us, and you can take from it what works for you to enable you to have those conversations so that you've got the tools to have some really productive chats with hopefully your state MP, but also others in your orbit who can help to bring the change that you need. So I'm going to throw back to Judith, and she's going to take you through the policy platform.
So in the lead up to the state election, Carers Victoria has been doing quite a lot of work over the last 12 months to start engaging with state MPs and talking with them about what it is that carers need to change. Carers need to change as opposed to carers don't need to change. And really, this platform that I'm talking you through briefly tonight is one that's been developed by listening to thousands of carers, to getting their insights through all kinds of things, from focus groups, from surveys, from conversations at events, and to try and bring that up into some key themes. It is not trying to fix everything for every carer, but rather to tackle some of the big issues that A, we think are reasonable for a state government to do, B, are achievable for a state government to do, and perhaps most importantly, C, deliver practical changes for carers across our state. So let's kick on, shall we? There's really, just to put a little bit of context about this, when we've been speaking to MPs, we've been pointing out that carers just do such a mission critical thing across our state, and that delivers a huge range of benefits for their families, for their communities, and for government in terms of replacement economic value. But carers pay a price for delivering that. And what we want to see through the things we set out as a 5-point plan in our pre-election platform is some changes that recognise what carers do, start to deal with some of the issues that they're experiencing, and make sure that they are recognised, that they are included, and that they are supported in their role. In doing this, we've also tried to design something that aligns to the recently refreshed Victorian Carer Strategy, so all the pieces fit together. So let me walk you through this. Now, we will supply you with a copy of this presentation, so no need to madly scribble anything down. And this very pretty diagram here gives you the 5 elements to our plan. Let me talk you through them briefly. The first one is about reducing the cost of caring. So many of you know that when you are in a care relationship, you incur extra costs, and it also often impacts your capacity to participate in paid work. So you'll feel like you're working all the time. About 2/3 of carers are providing more than 60 hours of care a week, but you're not paid for it. So these are very practical things, such as expanding discounts and concessions for Victorian carer card holders. Some of you will be aware that recently carer card holders had free weekend public transport made available to them. We'd like to see that extended. We'd love to see some discounts on things like road tolls. We'd like to see a contribution towards the cost of hospital parking. Some of those things that are just all adding up in terms of the costs of actually being in a care relationship. We think there's some important things that need to be done specifically targeting young carers. So while we welcome the Victorian Government's commitment to making public transport free for under 18s across the state, we want to see young carers who are on who hold carer cards able to get free public transport up until the age 25. If they're applying for a licence, we'd love to see them be able to do that without incurring the costs of getting that licence. And we'd also like to see some growth through a shared arrangement in our Young Carer Award scheme, because often having access to a small amount of discretionary money means that a young carer can do something that all their peers are doing, but there may otherwise not be money for. We also are part of a broader alliance that's seeking some changes to the Victorian Patient Transport Assistance Scheme. Those of you in rural Victoria will just be all too well of the cost of transport associated with reaching appointments. This is an important scheme, but it's a scheme that needs some changes to really deliver on its promise. And we will continue to advocate and encourage everyone at the state level to advocate for changes to carer payment and carer allowance arrangements, not just the rates, but also the eligibility and the processes that create a lot of barriers to carers just getting a bit of financial assistance when they really need it. The second element of our 5-point plan is about growing funded assistance and respite. And we see this as being essential as the number of carers continues to grow. Between the 2016 and 2020 census, the number of people identifying as carers in Victoria grew by 23%. And we need to see some growth in funded respite to meet the need of that growing number of carers. We recognise that particularly in rural and regional, in growth corridors, and for some groups such as multicultural carers and First Nations carers, there isn't enough of what they need in terms of respite and a break from caring, and we'd like to see that addressed through commitments of the next government. We're also keen to get some support for intervening earlier in the care relationship. Many of you have been in caring roles for a while. You remember what it was like when you first found yourself in that place. It was pretty tough. It was pretty hard to figure out what was available, how to navigate systems, how to find what you need. We've been developing a program called Step Into Caring that can give people that information and advice, can empower them, can connect them to others in similar circumstances locally, and really set them up so that they are better able to help maintain their own well-being and sense of self as they continue in their care relationship. And that feels like something, I've not yet met a carer who thinks that's a bad idea, because so often we're all muddling through trying to figure it out at the same time as we're trying to keep the rest of our lives going. The fourth element of our platform is about expanding local networks and supports. Because often, I've never met a more time-poor group than carers. We're already trying to balance so many different things. If you have to throw in the time and cost of travelling to access support, it just doesn't work, does it? The risk is you don't get any connection. You don't get that kind of support that can make all the difference. So we're looking at various initiatives that can build the access carers have to local support. And that isn't always carer specific. Sometimes it'd be about if you're living in a particular local council area, You being able to readily know, are there programs that will give you some social connection funded by the local council that you could access by driving 5 minutes rather than 2 hours? We want to see things such as community grants that let us tackle areas where we know there's just a gap in the system for carers who may have specific needs, or maybe living in an area where there isn't a carer support group and there aren't services. So keeping that focus on local connections is really critical. And the fifth element of our plan, by no means the least, I should say that 1 to 5 is not a reflection of priority, but rather a reflection of we can't figure out a better way to present it, is this focus on recognising and including carers. Carers have something valuable to deliver to service planning processes. They have something valuable to deliver to service review processes. They have something valuable to deliver to advisory groups. And yet often there's not a seat in the table for carers. We want to see that change. We also want to see things such as big employers like the Victorian Public Service become carer friendly, so that the 1 in 8 people probably in that workforce who is a carer can actually do their job and balance that off against their care relationship in a way that works for them and is good for everybody. And the final element we have sitting in here that I just wanted to finish up is what needs to happen for young carers who are in the education system, be that school, be that university, be that TAFE. Too often at the moment, young carers have a patchy experience. They may experience some great teachers and lecturers who really support them, but often when they need to ask for some special dispensation to recognise that their care relationship means they need extra time to do a piece of assessment, or otherwise is impacting their ability to complete things in their course, they find that they have to work very hard, and they're struggling with this perception that they seem to be less dedicated, less committed, or just not working hard enough. We need those systems to work for young carers rather than young carers having to justify themselves in those systems. And while we've seen some great progress at a Victorian level, we want to see that move on to the place where it works for every young carer and it is just part of their experience of education. So that's our 5-point plan, folks. We hope that there's something in there that resonates for each of you and connects to your own experience of caring, of what you've seen, of what you've felt, and what you need to change. Because ultimately, our goal in this pre-election period is to make sure that carers are heard, that carers cannot be overlooked, that everyone understands why they're important, and that we can together work towards a better future for all carers across this state. Let's do this, folks. So the next piece we were going to do was a bit of a fireside chat. Without the fire, my apologies. And really, it was a chance to pick up on some of the, quite frankly, pick up on some of the expertise that Zoe brings to this kind of area, so we can all benefit from it. In the first instance, Zoe, you've sat across the table. So we're asking a lot of carers online tonight to think about how they engage with MPs and how, what we need to do is make it as easy as possible for them to be really effective in doing it. Can you tell us about what you've experienced as the most impactful visits you've had from constituents? What are the tips and tricks that they might want to be alive to when they're thinking about getting ready to talk to an MP?
Absolutely, and we will have some Q&A from you later in the chat, and please use the Q&A function rather than the chat function. So at the top of your screen there's a Q&A button, put your questions in there and Judith and I will get to them a bit later. Basically it's about people coming into the office or emailing or calling with their authentic lived experience and being able to explain that to their MP in such a way that their MP understands what is going on with them. It might sound simple, but actually I found that a certain type of person will come into the electorate office, and often as an MP you can be flying blind on some of the bigger issues affecting our communities because you're just not having access to the people who are actually having those experiences. And I think that carers are a classic case study of that. Because you're also busy, time poor, often under financial pressure, and your capacity is quite limited to actually strike out and have those conversations with your Member of Parliament. But it really is worthwhile. And I had people contact me in various different ways. So some people will literally walk into the door of the electorate office and say, I'd like to have a meeting. Other people will call and ask the staff member if they can speak to their MP or make an appointment. Some people will send a detailed email or make contact through social media explaining what is happening for them. And it's incredibly useful and helpful when it comes to policy development. I think also when people get a little bit organised and when there are common issues that thread across communities, getting a group together to actually organise a meeting with your MP is a really worthwhile exercise. It's more efficient often for the Member of Parliament, and they are very time poor as well, but it also potentially takes the pressure off you having to go individually to try to advocate for some really important issues that affect others around you as well. So definitely encourage that, and I think it's really worthwhile. From an example point of view, I think the most obvious one that comes to mind is very soon after the 2022 election when a mum came into my office and explained her daughter's experience of an eating disorder and just how that was affecting both the child but also the rest of the family in terms of the fact that the mum had had to give up work, that there were mental health issues among other siblings, that it was causing financial pressure, marital pressure and such. And as an MP, I took this really seriously. The story was so personal, but also so clearly real and embedded in evidence of what was happening for this family that when I scratched the surface of that issue, I realised how pervasive eating disorders were within our community. And then as an MP, I was able to take action to actually shift policy, bring attention to that issue, get funding into that space and enable some support at both state and federal level in that case to families. So it really is worth having those conversations, and that's a good example of a literal change from one conversation with one constituent.
That's a great example, Zoe. And across Victoria, we have something like 400 carer support groups. So where they feel comfortable doing so, getting those carer support groups to connect with MPs is something you feel both has safety in numbers for someone who may be less comfortable to do that one-on-one, but also is attractive to an MP who might get 8 or 12 people around the table. So that is a strategy you feel has some power if people are comfortable?
Absolutely. And look, at the end of the day, it is the job of your Member of Parliament and their staff to represent you. It's not an easy job. Electorates are big. There are lots of competing issues. In many ways, arguably, by actually getting organised and enabling the conversation, you are helping that MP do their job properly. And I think absolutely getting together in a group is really worthwhile. As I said, it takes pressure off you having to organise it individually, but it's also a demonstration of the pervasiveness and the commonality in the issues and the pressures that you're all facing to get a group of people into a room. It doesn't also necessarily mean all of you getting organised to go to the MP's office. You can organise something at a time that is convenient to you in a church hall or at a community venue and invite the various MPs representing your area potentially in the state context at upper and lower house level to have that conversation. The thing is that often when MPs get correspondence or a phone call, if you've had this experience of getting in touch with your MP's office, they'll say to you, where do you live? And that they're asking that because they want to know, are you one of my constituents? And if the answer to that is yes, they know that their job is to represent you. And it doesn't have to be combative. It is really an information gathering exercise for the Member of Parliament to understand the really important issues affecting carers and how they can help and how they can advocate for you.
That's great, Zoe. One of the people that many of you will be familiar with is Helen Johnson, who has been a very long and fierce advocate on behalf of carers in this state, particularly for rural and regional carers, and currently functions as our carer advisor to the board, providing our Carers Victoria board with direct advice about what she's seeing and what she's hearing from carers and what they're telling us needs to change. We asked Helen to reflect a little on what she has seen as some of the greatest successes she's had in her time of being an advocate and engaging with MPs. So we've got a pre-recorded session we'd like to share with you of Helen speaking to her own experience, what she's seen, what she's learnt, and the tips and tricks she thinks would be helpful to share with you. So we might just pass across to that.
As one of Victorians' nearly 1 millionth unpaid carer, I know I need to be in a good frame of mind, and that's what I found effective. I had to be in the right headspace before approaching any advocacy or, addressing any issue with a member of parliament, an MP, which we'll refer it to. I like to approach issues and challenges with a solution focus. And I think it's really important to keep it really succinct. So, many of us as unpaid carers have many challenges and issues that we'd like to raise, but I think it's really important to really prioritise and maybe raise one or two issues when you're meeting with a member of parliament. Always being respectful. I know, we want to scream and yell from the rooftop, but often being respectful will allow the MP, and I'm going to throw in their advisor, to listen, because it's their advisor that is taking on everything. So I think it's just really important to also focus and address with the advisor and the MP. MPs are time poor, so being factual and straight to the point, as I mentioned, prioritising maybe one or two issues or challenges and going in there with a solution focus. And as I mentioned, the advisor is a really I call them a friend, the friend of the MP that you really need to get to know. That's what I found effective when I'm addressing both federal and state members of parliament. So you'll often go through their personal assistant. And so when you do contact and arrange that meeting, making sure you find out the time that you'll have with that MP. Now, sometimes that has to be cut short. I've had many appointments with MPs and it's been cut short. So it's just really important to know the time you have, who they are, who you're going to see, and then develop what you're going to say. At the end of the day, I feel it's important to focus on what Carers Victoria's election platform is, and what I love about the election platform is that it's real and it talks about the carer economic security. Carers are financially and we are in a space of real financial difficulty often, every day, and so it's really important that we ask our members of parliament to really understand and focus on the economic security and also the well-being of carers. Do they really understand our role as carers and the amount of hours and time we spend in unpaid carer for our loved one? So I just believe we need to inform the MP around our purpose of this election platform. And so I urge every carer to have a look at the election platform that Carers Vic have developed and utilise it, because we talk about the cost of living and relief in that area, the expanding of the carer card, and more benefits. And I believe there needs to be more accountability from our community members, from our businesses towards that carer card. There's not enough funding in the carer card to promote it and enable businesses to grasp it, acknowledge it and honour it, so that we as carers can have a little bit of a less financial burden when we're trying to access community and or activities. A direct financial relief package for carers is really important. If the state could come up with, helping us in our in our financial hardship, and that could be petrol vouchers, that could be food packages, it could be anything you need that's causing financial stress to you. These are items we could share with the MP, coming with that solution. And also meaningful and increased respite, not just emergency respite, which the Carer Gateway promote and offer as short term. MPs need to understand we are doing this care 24/7. So relief and meaningful respite is required, needed to ensure we can sustain that ongoing care of our loved one.
Thanks, Helen. It's really great for everyone to benefit from the depth and breadth of your experience. And we do have Helen online for the webinar tonight. So those of you who have access to a keyboard, do give her a bit of applause for the contribution she's made today and for the work she does on behalf of carers across this state. We'd also love you to ask any questions you might have by putting them in the chat now. What we find sometimes is we can't get to all the questions, but any we can't finish today, we will circulate with answers to everyone after this webinar. So you've got Zoe here. If there's anything you'd like to ask her that would help you in thinking about how you might go about the process of engaging with an MP, please pop it in the chat now and we'll look and aim to get to as many of those as we can. While those questions are coming through, I did want to ask you, Zoe, sometimes when you contact an MP's office, you might get offered a meeting with an electorate office or some officer or some other staff member. If a carer online gets made that offer, what should they do? Should they take it up?
Absolutely. So it's actually really valuable to meet with advisors, and as you may have noticed, your members of parliament tend to come and go, but often advisors have more continuity than the members themselves. And indeed, many of the advisors have really deep expertise in some of these policy areas. So it's absolutely worth having a meeting with the advisor, and it's worth actually relationship building with that advisor, because a lot of the policy change that we would like to see, notwithstanding everything that you've articulated, Judith, about what we'd like to see between now and the state election, many of these asks need to happen over the long term. So it's important to build allies, and those allies can be MPs themselves, but those allies can also be their advisors. And you might find, for example, that you develop a relationship with an advisor who's working in your local MP's office, and then who knows, after the election they could end up being the chief advisor to a minister, and then you have a direct line to that person. So these things have a way of coming back around, and it's definitely worth having that conversation.
Yes, that's certainly my own experience, is often talking with advisors. They pop up in all kinds of wonderful places, people. So well worth taking that opportunity and talking and sharing your story. Zoe, one of the things that I think can be quite challenging is often your story of being a carer is quite long and complex. How do you distill it down to something that really can stand out, that an MP who themselves is busy can relate to and connect to? So you talked about the eating disorders example, but that's getting that simplicity of stories is really hard to do if you're a chatter like me or you've been through a lot. How might you go about that?
Yeah, it can be really difficult, especially when at a personal level everyone's dealing with so much complexity and often multiple levels of caring that are affecting different facets of family and community life. One of the other things we've been doing here at Carers, as you know, Judith, is helping some carers articulate themselves for journalists. And I think that there is some crossover in that conversation and the way that you have the conversation with your MP. And one of the things that I talk about in a lot of the media training that I do, not only here but elsewhere, is something called the message triangle. And it's just a way of sort of simplifying your own thinking around what you want to say. And you know how it is when you're going into an important meeting and you kind of think, oh God, I really hope I get out what I need to say. if you use the message triangle, you can kind of remind yourself before you go into the meeting about the things that you want to get out. So the first thing is, what is your story? What is happening for you? If I was to ask you, what's going on in your life? What's the most important thing that you want to tell me? If I got in on one floor in an elevator and got out on the next floor, what would you tell me about that? The second piece of the message triangle is, what is the impact of that on you as a carer? And what is the broader impact on your family and the broader impact on your community? And then the bottom part of the triangle is, what would make a difference? What would change that for you? And that's a way of then pegging those first two things back to some of the things that are in the Carers Count strategy that, of course, it's not everything, but some of those things might make a difference to you as a carer. And, you know, the first thing that would make an obvious difference, apart from anything else, is recognition, being seen. And that's the first part of the matrix, I guess, in the conversation that you're going to have with your MP, to say, not only see me, but hear me. I want to have this conversation with you so that you understand my situation and that I can enable you as a carer to understand that so that you can take these things forward in order to help change policy. And, you know, some of the questions that are coming in on the chat, Judith, relate to this. One is, how much detail should we provide to MPs? Is it best to keep it simple dot points, or is a human story that connects them to the issue a better strategy? I think the lived experience story is critically important in these conversations, but then so is what would make a difference. So you need to be thinking about those two things when you go into a conversation with your MP. And I think that one of the things that the 5 points in Carers Count give you are some things to lean on when the MP says, well, what can I do that would make a difference? What would change things for you? That you can speak to things like better funded respite. You can speak to things like earlier intervention. You can speak to things like discounted transport costs and things that will reduce the cost of caring. So having those things that you can bring up as you speak to your broader story, I think, is really important. And then Jane says, is it helpful or counterproductive to end a meeting with an MP asking for some concrete commitments or targets? And it's a really good question, because I think that, you know, it can be difficult to go into a meeting with an MP and sort of say, well, these are the things that I think you should do. And evidently no MP is going to say, sure, I'll get that done for you in the meeting. But I think that what you can ask for is, so what are you going to do now? And as an MP, I would often say, well, firstly, what's the ask? And I want to be really clear on what that ask is. And then as an MP, you can offer the range of actions that you can take, that you will sit down and discuss it with the minister, that you will advocate for the issue, that if you're an independent member or a member of one of the minor parties or an opposition, that you might ask a question in the parliament, that you'll raise it in the parliament, that you'll raise it in the media. You know, there's various mechanisms that you can use to do this kind of advocacy.
And Jane, in my experience, after you've asked that question, you can also offer up the question which is, and what can I do? Is there anything else I can provide to you that would help with that? Because often it's the start of a conversation, and what you're trying to build is something that says, we want to see change and we're happy to furnish you with what you might need to get there. Given what you've heard, what you're thinking about doing, anything else I can do for now, which kind of leaves the door open for a future conversation as well.
Yeah, and there's a question from Sam for you, Judith, saying, which is related. If I was ready to go into an advocacy meeting with my local MP, what would Carers Victoria do to help or back me up for this discussion?
Oh, Sam, perfect question. Thank you. You've actually scripted me before I could deliver the script. So we are preparing a whole lot of materials that will be available for all of you. We'll provide you with scripts and other resources that you can use. Contact details for your MP if you want to send an email. It makes it really easy as possible. We are trying to make this as simple for you by providing really quick, easy information that you can take along and give to your MP. And if you're not sure, you can always drop us a note and we can give you some tips and tricks. You know, if thousands and thousands of you all contact us at once, it might take us a little while, but really over the coming through few months, this is such a priority for us, Sam, that if there's something else you need to feel confident or you just want to, you know, check in, we'll try our hardest to back you in on that as well.
And I would add that I think some of those statistics that you can get from Carers Victoria are really useful in these conversations. I don't want you to feel like, you know, you have to have all those stats in your head, but if you've got that one pager with you that you can hand over to the advisor or the MP, I think that's useful, because if the MP buys into the issue and decides to take it up, and perhaps they want to talk about it in the parliamentary chamber, it's really useful for them to be able to say, well, in my constituency, I know that I have this many people who are in unpaid caring roles, and that those people need the support. So this is how we start to build the momentum and also the understanding of just how many carer connections there are within our communities. One of the things that I think is important to note is, you know, you can't make an assumption that everyone knows what you're grappling with. I think people need to be told, and that needs to be clearly articulated. And I think that if you have an opportunity to have a conversation with your MP to explain it, I think the vast majority of MPs from any side of politics are going to think, well, gosh, that really needs to be paid attention to. So it's to do with sort of distilling that message properly.
Can I add something just very quickly? Sam, the other thing that really gets people's attention in an election year is recognising that 1 in 8 Victorians is in a caring role. Those are pretty striking numbers. So electoral maths kind of requires them to have an interest. That number, we've shared profiles for every single state MP of how many carers they have in their electorate, so they have had that information, just to try and get a bit of attention on the issue. So when people like yourself, if you engage with your local MP, they shouldn't be completely cold to the issue, so to speak. Sorry.
Yeah, so there are a couple of other questions around the sort of mechanics of this. So Steve says, how deep do you have to go into the mechanics of laws and Parliament and whether something is state or federally run? Will it put the MP off if you don't know? And then there's a related question from Helen. Can a state MP look at the lack of services available due to the housing crisis? For example, workers have long travel time to service clients. Well, you know, there is overlap between state and federal issues. And look, occasionally you might get a state MP who's going to say, oh, well, that's a federal issue, or the other way around. But the thing is, you're still a constituent of theirs. So if there are issues that are affecting you, it's important that they know about it. And with something like housing, for example, there are overlaps across both jurisdictions around housing, and it's really worth having that conversation. I wouldn't get too sort of bound up in the minutiae of should I be having this conversation with my state MP, should I be having it with my federal MP? You know, they're both there to represent you. I think that, you know, in the current context, though, we do have a state election coming up in November. And so hopefully the listening ears will be a little bit more attuned to actually having those conversations.
And one of the things I think that's a bit tricky at the moment is most of you will have heard conversations about the state of the state budget. So our platform's been very deliberately designed to be practical, scalable, achievable things, because when you're in a budget constrained environment, it can be hard to get government to commit to big, broad things. So just, I think, to echo what Zoe said, it's really about connecting to your story and what matters most. Don't worry about the technicalities about legislation, etc. Because while it might be the case, I was a carer of my elderly mother. Aged care is delivered through a federally funded system, but the work that I was doing helped keep her out of state-funded health services. So I don't think you need to feel contained. Just be aware that you want to target something of your conversation to practical things that your MP can action. We were talking about conversations I had with some MPs down on the Mornington Peninsula, And because we were talking about really practical things like getting carer card holders access to energy concessions, that was something really concrete they could grasp and run with. So you're just always making that judgment about it's got to be the thing that's important and authentic to you. But at the same time, if you can be focusing it at something that is scalable, achievable, and quite concrete, it's often easier to get from the conversation to some action.
Agree completely. Sally says, if there are signs of a very clear result in the election, is it best to target the relevant minister or go local and speak to your member, no matter which party they belong to? Firstly, I don't think it's going to be a very clear result ahead of the state election. I'll just put that there. Different circumstances perhaps, or things could evolve between now and November. But the thing is that I would say the minister's always going to be much harder to get to, and the minister's going to be dealing with things at a much higher level. So, I think it's really important to go local, engage with your local member, build a relationship with your local member. And yes, okay, maybe it makes a difference whether their party's in government, but maybe their party won't be in government after the election. So it's still worth having the conversation no matter who it is. And I think also the understanding of the influence of the backbench is kind of low. The backbenchers are the ones that exert the pressure on the executive. And at the end of the day, members of parliament want to win their seats back. And so if, as Judith explained, they understand the number of carers that are within their community and what an important voting bloc that is potentially enough of a motivation to get them to pay attention to the issue. Not to be cynical about it, but that is sort of the literal situation that members of parliament find themselves in.
Could I add, so by all means, if you have a close relationship with a cabinet minister or a member of shadow cabinet or other, feel absolutely free to have the conversation. That is fantastic. We are asking you for a focus on your local MPs because that way we get across the state to everybody. And I did want to reassure you, we met with the current Minister for Carers last week and presented the platform, and we've been talking to her about this for some months. We're meeting with the Shadow Minister for Carers in a couple of weeks, and our chair was meeting with the Leader of the Opposition last week. So at Carers Vic, and this kind of harks back to what you were asking a bit, I think, Sam, we're really doing all we can to reach those members around the cabinet table who are most influential, both in government but also in those in opposition and other parties. And we enjoy a good relationship with pretty much all parties that are in the chamber because, as Zoe said, sometimes it's the balance of power in the upper house in government that makes all the difference. So we're really keen collectively for us to reach as many of these people as we can. So you'll all have a member in the lower house, and then there'll be a number in the upper house that cover a big region, including where you're living. So you might, pick one of those upper house folk as well as your local member. And those upper house folk are really interested in a lot of the things we've been talking to them about. So, go forth, have as many conversations as you feel comfortable having.
Yeah, and it's important to note on this particular set of issues that these aren't partisan issues.
No.
This is cross-cutting issues that affect all facets of our community, and it doesn't matter which party your local representative comes from. They will have many, many carers within their community. And I see it in part as an educative process, actually, for you to be heard and seen. And I think that's a big piece of what we're trying to do. Just on that, Judith, there's a question from Barb. Is a focus like National Carers Week important for advocacy, given how close it'll be this year to the election?
Barb, excellent question. It was a very important focus for advocacy last year, actually. So last year we ran an event at Parliament House and got I think the technical term is truckload of MPs passing through. And that was part of a strategy to really engage those MPs early, get them familiar with the issues. We provided them with packs of data and they got to speak to a whole lot of organisations supporting carers. This year, you're right, is a bit tricky. So by October, we're still going to be encouraging everyone to connect to MPs and, invite them to things that might be going on. But a lot of the decisions about what goes into things like party platforms will be already made. So interestingly, this year will probably be National Carers Week in an advocacy sense. Will be more about reinforcing the work we've already done, the connections we've already made, and the support we've already built. We think the next 2 to 3 months are going to be really critical in MP engagement, because what we'd love to see is specific commitments about carers included in the platforms that the major parties, and indeed all parties, put out before an election. Because we know if we get some things related to carers into those, whoever gets in, that's a fairly strong commitment to delivering on that commitment. So the next few months are pretty critical.
There's a really good question from Jane, which is the story of the carer or the care recipient more important? Mm-hmm. And I'll let you answer it as well, yep. Judith, but I think that in this case, we're talking about your experiences as carers. There are an enormous number of complex issues around care recipients. Many of them are overlapping in state and federal policy spheres. But this piece of advocacy that we're trying to do is to elevate your lived experience as a carer, something that sometimes gets overlooked in this conversation around care. And the power that you have is the power in your story as a carer, a story that many of those who you're telling it to may not have either heard or considered. So it's actually a different way of telling a story about care that I think is really important and is potentially getting overlooked, and that's the opportunity here.
Absolutely. So Jane, it's not to diminish the experience of the person in your care relationship, but this is indeed all about your story, about what it's meant for you and your people, and what you need to change to be able to continue doing this in a way that benefits not just you and the people in your care relationship, but benefits the broader community. Because at the moment, carers sometimes feel pretty invisible and taken for granted. So a really key part of what we're trying to do here is make it impossible for carers to be ignored by MPs. We have been encouraging MPs to use their networks to promote information about carers more generally. So while our primary focus is raising awareness and garnering commitment for real practical change for carers, the side benefit is them really understanding what it's like, what it means, and we all are going to know one, need one, or be one. So there's an absolute human element to this as well. It's just something that, you know, often people haven't thought about till you sit down and tell a story about what it's like for you.
Mm. There's a really good question from Vicky. What's the best way to approach a local member who's in a very safe seat that you've used the approach that I've suggested and don't get a response? So I think there are a few ways. I think that in the lead up to an election is a good time to try again, because there's going to be more motivation to focus on community issues. I think that depending where you are in Victoria, having conversations with local journalists to elevate the issue within the local media, so be that community radio, if there's a local newspaper, to try and get some coverage there. But I think the other way, as well as what I've already suggested, so trying to get meetings and such, is to actually run a community event in the lead up to the election and invite all of the local representatives to attend to hear the stories of carers. Then it sort of creates a situation where it does happen, but it's more difficult for one candidate to not turn up if all of the others say that they're going to be there. And then you create an opportunity to actually have a reasoned conversation about the kinds of issues that the community is experiencing.
Mm. And Vicky, was it Victoria?
Vicky, yeah.
Vicky. The other thing is, when I've been talking to MPs, you know, it doesn't feel like there's such a safe seats feel much less safe than they used to, I think, and everyone's a bit alive to that. But I can't think of a time where I've spoken to an MP when they weren't interested in what existing groups there are or the opportunity to engage with groups of people. So the other observation I'd make is, if you're finding it hard to get a one-on-one, it might be, you know, that kind of creating an opportunity for a group of locals. It can be quite a powerful thing, I think.
So there's one last question. I'm going to throw it to you, very policy focused. So having increased respite as a target is a laudable goal, but how do we access external respite when organisations are closing their respite? this would be a federal issue as it's a direct impact on families of a lack of respite in their family members' NDIS plan. How would my local MP influence change in this area? I can take that bit. But this broader issue of trying to raise those big core problems and bring change.
Do you know, it's interesting, both the National Carer Strategy and the Victorian Carer Strategy have been refreshed in the last 12 months or so. And both levels of government heard through that carers are increasingly mission critical to the future and they need respite to be able to do that role. So I think the voice and the noise around this is getting louder. I think there are still fundamental challenges about thin markets and the like. So a great example would be the deaf and hearing impaired community and their challenges in trying to access emergency respite where there just isn't something that suits. So I think you are right, it is incredibly difficult, particularly in budget constraints where we have governments that have to choose between do they fund more carer respite, do they fund more ambulances, do they fund more child protection workers, do they fund more hospital beds? But part of getting up that list and priorities is as many people as possible making MPs see that this is something that is mission critical, that it's not just a small number, but it is affecting so many people in our community. That won't make it go away overnight. It's hard, there is never enough money for everything we need, but we are also trying to look at other strategies that recognise other parts of the community can support elements of the support that carers need.
Yeah, I agree with what Judith said, and I'll just answer briefly on the MP's influence piece. Some of these things take time for the pressure to actually land. But the thing is, if you don't exert the pressure, it will never land. So on a big piece like that, it really is to do with having those conversations with your MP so that they're aware of it. And if they're on the backbench, that they can be pushing that forward into the senior levels of the party to bring about the policy change. Often it doesn't result in instant change, but certainly there won't be a change if your MP is not even aware of what the situation is. But also, what the practical impact of that is on you. It's all well and good to hear it as part of a government inquiry or in some speech in the parliament, but having a constituent, believe me, come into your office and actually tell you what is happening because of their lack of access to a particular service lands much harder on an MP. And I think the vast majority of MPs, no matter what their stripe, will actually try to make change when they understand the human impact of that kind of situation. And again, policy levers work slowly, unfortunately, but still, as communities, we have to exert pressure to get them to shift.
We are just about out of time, folks, and I know there's other questions we haven't been able to get to. So just to kind of wrap this up, I just wanted to make sure you're all aware that after this event, what we'll aim to do is get out to you via email within a few days copies of the material we've shared, Q&A, so what are all the questions that were asked and what are the answers were given. The only exception to that is if someone's asked quite a personal question, we won't share that with the group for obvious reasons. We'll also be supplying you with links to resources that can assist you if you want to pursue some engagement of MPs. As we finish, I need to ask something of you. These are areas that we are all learning as we go. And for us at Carers Victoria, we want to make sure that things we do like this are as valuable as they can be for you. I know we're all a bit exhausted with online surveys, having lived through COVID and the gazillion surveys it felt we had to do then. But we are going to ask you to complete a quick evaluation of this session, what you found helpful, what you'd like more of, because that can help us better support you as we work together to make sure that carers are seen, carers are heard, carers are better supported, and that fundamentally we cannot be ignored. So I'd like to thank you for your time. I'd like to thank you for the work you do as a carer, for the connections you make in your community to make this an issue that more people understand. I'd also like to thank Zoe, because it's great to have someone with her expertise as part of this work. And I think we just crack on and do the very best we can to make sure that this election, carers across this state cannot be overlooked. Thank you and good night.